Hello, I'm Dr. Krishna Kanuri, orthopedic consultant, Asvins Hospital, Somajipuram. This month is actually the month for awareness for juvenile arthritis. So juvenile arthritis, first let's explain the term juvenile and arthritis. Juvenile is categorized by any person under the age of 16 years. Arthritis needs no introduction. The word arthritis medically means inflammation, but is symbolic with wear and tear of the joints. Most commonly what we see is the knee joints, and usually the word arthritis is associated with elderly patients. But the reason why we've chosen this topic and this month, July, is basically there is always a possibility of this presenting in younger individuals as well. The Arthritic Foundation has announced the month of July as the month for juvenile arthritis. Initially, juvenile arthritis was categorized as juvenile rheumatoid arthritis, but now it's been categorized into as the name has been changed to juvenile arthritis, and it does include a lot of autoimmune conditions as well. So primarily in children, juvenile arthritis is a condition that most commonly occurs as a result of autoimmune disorders. What we mean by autoimmunity is our general immune system, if I were to explain, when there is a invasion of any bacteria or virus, any organism in our body, our immune system gets active and generates a strong immune response to eliminate the invading organism and brings about a status quo. But in autoimmune conditions, what happens is it is usually triggered by a viral infection or a bacterial infection, and immune response is created to eliminate these bacteria and viruses. But unfortunately, sometimes what happens is the immune system's overactivity leads to damage of host tissue. So in case of juvenile arthritis, usually it is the synovium and capsule of joints, but also other organs can also be involved in these cases. The more common organs that are involved in juvenile arthritis includes the eyes, where symptoms are primarily dryness, redness. In children, you have growth restriction, and in some you might also have intestinal issues such as diarrhea and associated weight loss. But most commonly, what you see is stiffness and pain in movement of the knee joints. So, coming to the diagnosis of juvenile arthritis, it's mostly by looking at the blood markers, the inflammatory markers primarily, and further examination of the involved joints also can be done. But the most important takeaway from all this is juvenile arthritis, when identified early, especially in children, when identified early, what happens is, and when we start medications such as DMARDs is what we call them, or disease modifying anti-rheumatic drugs, or a light dose of steroid, what happens is we do arrest the progression of the condition, leading to arresting arthritis at an early stage, not requiring any physiotherapy or any intervention at a later date. So, juvenile arthritis is a condition when caught early is one such condition where the progress of the disease can be arrested with just some medication. But the treatment of juvenile arthritis is usually multidisciplinary, where you have the pediatrician, the rheumatologist, and the orthopedician being involved, and the necessary physiotherapy team as well. So, any further information that you need regarding juvenile arthritis, you Arthritis Foundation site. And for any consultation, you can visit us at Asvins. Thank you so much.